All right. This is Robin Blake, nurse practitioner student for Walden University, and I'll be conducting the head-to-toe health assessment today. Hello. Hi, I'm Robin Blake, nurse practitioner student with Walden University, and I'll be conducting your head-to-toe assessment today. Is that okay with you?
Yes.
Okay. So first, I'll start out by just examining her head, just to see if there's any cuts, bruises, any rashes, any infestations, anything like that that I can see, which I see none of. And I'm gonna then palpate it, any lumps, bumps, bruises, abnormalities, and I don't feel any of that. She has a normal hair pattern. She has a normal hair distribution, thick hair, wavy, curly in nature, and I don't see any abnormalities here. So then I'll move on to inspecting her face, and her face is symmetrical. She has even distributions through her eyebrows and her eyelashes. Her eyes, her face is symmetrical, and round. I'm just going to take a peek at her conjunctiva, which are pink and moist, and also her oral mucosa is pink and moist. So now I'm going to palpate your frontal sinuses and your maxillary sinuses for pain, and then I'll also percuss them for any pain. Next, I will look into her eyes. Excuse me. Alright. So, I'm just going to take a look into your eyes. You can just take a look straight ahead for me and don't look at me. Okay, good. And again, I'm going to do the same thing. Just going to come from the other side. And I'm able to visualize her macula, her disc, which is bright orange, and her A to V ratio is 2 to 3. And I'll move on. Now I'm going to track her cranial nerves, which is a part of the eye exam as well. And I'll ask you to follow my finger. So we'll track cranial nerves 3, 4, and 6. Which she did well with all of those. So that's great as well. Now we'll move on to the ear. So before doing so, I'm going to check her pupillary response. So, which is good. That should be a good pupillary response bilaterally. And then we'll move on to the ear. And since she is over 14, we're going to pull the earlobe up and back. Just going to first palpate her pinna to make sure there's no pain there. Alright, could you tilt your head to your left for me, please? Okay, and her ear canal is easily visible. There's a little light yellow silvery her tympanic membrane is visualized as pearly white. I'm going to do the same thing over here for her left ear. If you can tilt your head to your right for me. And I'm going to palpate her pinna once again to make sure there's no pain there, in which there isn't. And again, a thin sheet of yellow wax, and her tympanic membrane is easily visible. It's pearly white. No abnormalities in either earlobe. Just a little wax. So now we'll take a look at her oral cavity. If I can just get you to say, open your mouth and say ah, sticking your tongue out. Notice her tongue is midline, there's no deviation. Say ah for me, please. Her gag reflex is there. Uvula, midline, no redness. Mucosa is pink, soft and hard palate. Observed, and there are no abnormalities, no lesions, no dental caries noted. She does have braces. And if you can just stick your tongue out for me, I'm going to use this to move your tongue so that I can see underneath of it. And there are no observed lesions or abnormalities, no bleeding gums or anything like that. Alright. And then I'm just going to feel for her lymph nodes to check for nodules, which are pea-sized. When inflamed or something is going on at pea-size, and they can be more easily felt. So I'll start in her occipital with her occipital lymph nodes, which are normal. In her posterior cervical, posterior cervical, which are normal. Post-auricle, normal. Pre-auricle, tonsillar nodes, non-palpable. Submandibular nodes, non-palpable, and denti, non-palpable. We also have her anterior cervical lymph nodes, which there are no abnormalities, no swelling that I can identify with. If you can sit up straight for me. I also just look for any preclavicle lymph nodes, which I don't feel any of those either. Alright, so next I will test your hearing. I'm going to put my hand over your tragus and I'm going to whisper something, and I just want you to repeat back what I said. July 4th.
July 4th. Summer's ending.
Alright. So now I'm just going to use the tuning fork to assess bone conduction, and I'm going to start on her frontal bone. And you can tell me if you feel that on one side more than the other, or if you feel it both. Both. Okay. Tell me when you feel it stop.
Yeah.
What about here?
No.
Okay. And this is testing the conduction of bone conduction versus air conduction. Once again, put this on the mastoid bone. Let me know when you feel it stop.
No.
And let me know when you hear it stop.
No.
Okay, wonderful. So she did well with that. And while I had this, I'll go ahead and check for her sensation. What do you feel here?
Feel it vibrating.
Okay. This time, close your eyes. And tell me where you feel it and what you feel.
On my foot, and I feel it vibrating.
What part of your foot?
The left side of my foot.
Okay, great. Wonderful. All right, so now I'm just going to take a look at your chest. So I'm going to take a look at your nose, and then we'll move on to your lower body, chest and thorax. All right, and you can just put your arm to your side for me. Just going to take a quick look up your nose. Which hair is evenly distributed. Turbinate's clear. Mucosa is pink and moist. No abnormalities or lesions there. Alright, so I'm going to check her smelling. And you can just tell me, cover your right nostril for me, please. And close your eyes, excuse me, and tell me what you smell.
Smells fruity.
Okay. Now, I'm sorry. And close your left for me as well. Close your eyes. And then tell me what you smell.
It smells like cinnamon.
Okay. All right. So now I'm going to if you can sit up straight. I know it's a difficult. Okay, that's good. I just want to look at your chest as it rises and falls. It's symmetrical. There's no splintering noted, no lesions noted, and I'll go also palpate. All right. Okay. And so I'm gonna now listen to your lungs. Okay. Take some deep breaths for me. Sorry. Good. Nice. Okay, good. So there are no adventitious sounds, no wheezing, no ronchi, no rails heard in auscultation. Now I'm going to percuss for tactile firmitus. If you can say the word 99, the number 99 for me,
99.
which is clear, and there's no tactile firmitus heard. So now I just want to begin the cardiovascular portion of the examination, and I'll begin that by looking at her neck for any JVD, which I don't visualize any of that, and then I'll palpate the neck for the same, and I'll palpate her carotid artery. Okay. Mm-hmm. And I'll listen to some. Which is audible, and there are no bruise with the rose audible there. Excuse me. And now I'm going to auscultate your heart sounds. Audible. Audible S1 and S2 sounds without any rubs or murmurs or any other extra sounds that shouldn't be there. I anticipate her PMI to be right about here where the fourth intercostal space is. Excuse me. Okay, let me have you lay down for me. All the way flat. I'm going to listen to your heart again. And this time I'll check my estimation. 2, 3, 4. And this is where I expect to hear PMI, which is correct. Clear audible S1, S2 sounds without any bruise, murmurs, sluggishness. She has a good rhythm and rate. Listen here from that. And aorta, excuse me, aortic pulse. I'm going to continue on with the cardiovascular examination. Sorry, put your hands to the side. The radial pulses. Pulses. Excuse me, tibial pulses and pedal pulses, which are all normal and with a regular rate, symmetrical. Alright, there is no edema on observation, but I'm also gonna palpate for these things. Okay. And venous return is normal bilaterally, less than 3 seconds at the great toe. So now I will go ahead and ask you to turn over onto your left side. I'm gonna put this pillow under your head over there. Sorry. I'm gonna inspect her spine, which appears to have a normal curvature here, and I'm palpating it. There are no abnormalities, no lumps, nodules, palpable. And while she's here, I'll listen to her kidneys, excuse me, and percuss her back. Her renal arteries, excuse me. Right? Okay. All right, you can turn back over. I'm going to get you to sit back up for me. And I still need to check your trachea. I'm sorry, not your trachea, your thyroid and your trachea midline. I think I did that already, but if you could turn to your left for me, I can check your trachea again from this position. Okay. There are no masses or lumps on the trachea, and it was midline from my observation from the front. And I can palpate her thyroid here. I'm going to locate the bottom portion and ask her to swallow hard if you can, so that I can feel it. So if you can go ahead and take a deep swallow for me. Good. And I was able to palpate her thyroid gland moving freely without any masses or nodules that were, or swelling that was palpable. So if you can stand up for me, I'm going to move on to your musculoskeletal part of the examination. You can hold your arms out for me and do the windmill. Good. That's good. And what about doing side to side stretches? Any pain there?
No.
Okay. And this is good to also assess for any nerve root injury. I'm going to turn you here from side to side. No nuchal rigidity, and that can help test for meningeal irritation. So if you can go ahead and take 2 steps towards me, just 2 small steps, and then squat with your hands out as far as you can go, and lift back up. Okay. All right. You can go ahead and have a seat for me. I'm going to test your musculoskeletal strengths. If you can hold your hands straight out for me. Don't let me push them down. Don't let me pull them up. Hold them out to the side. Same here. Don't let me push. Don't let me pull. This way. Don't let me push. Don't let me push. Don't let me pull. All right. Your knees. Don't let me push. Don't let me pull. Good. Don't let me pull. Don't let me push. And don't let me push. And don't let me pull. Good job. Okay. All right. And let's see. Let me go ahead and get you to lie back down again. And now I'm just going to take a look at your abdominal region. And there's Good symmetry there. Oh, sorry. She has good symmetry. There are no aortic pulses there. There is no extra movement there. And now I'm just going to take and listen to her abdomen for vowel sounds, which are normal active and present in all four quadrants. So now I'm going to palpate her abdomen and her liver and feel for any splenic enlargement. So I'll do this, breaking the abdomen into 6 quadrants, or 6 areas rather. Just taking the time to feel for any abnormalities, any enlarged organs, mass bumps. And now I'm going to get you to take a deep breath, and I'm going to push down up under this rib to see if I can feel for your liver. So take a deep breath for me. All right, and let it out. Okay. So I can feel the very tip of her liver here, and I'm going to have you do the same thing again over here. And I don't feel any spleen over here, so that's good. So just going to go through, just feeling the hips and the knees. I'm going to also do some range of motion with your hips, so just let me control the hips. Good range of motion. Good, no clicking, no locking, anything like that. Shoulder feels stable. I'm going to take it around a range of motion as well. The other shoulder. Good. No clicking, lacking, or abnormal reduction of range of motion there either. So that's good. Now close your eyes for me. Tell me if you feel something sharp or if you feel something dull.
Sharp. Dull.
Okay. Close your eyes. Alright. And I'm getting ready to do the patellar reflex, which is hard to demonstrate here. Okay. And she's ticklish. Alright. So if you don't mind turning back around for me, I'm going to do sitting up, I'm sorry. I'm going to do the mini mental test. What is today's date? What's the year?
2016.
Okay, great. And I'm going to name 3 words, and I want you to repeat them back to me. Vanilla, chocolate, strawberry.
Oh, vanilla chocolate strawberry.
And can you spell world backwards for me?
DLROW.
Good. And can you repeat those words back to me?
Vanilla strawberry chocolate.
Okay, not the same order, but it's okay. Now, close your eyes for me. Okay. You can open them. Now I'm going to test cranial nerve 7. If you can smile, frown, and puff your cheeks out. Great. And let me see. Close your eyes. Don't let me keep them closed, so try to open your eyes. Great. Good, good, good. All right. And then if you can take your arms and touch your nose with each finger, with each pointer finger. Excellent. Your mandible. This is cranial nerve 5. If you can clench your teeth for me and then grind your teeth together. Okay, thank you. And let's go ahead and test your deep tendon reflexes. right left side of breathing. Alright, we'll do the biceps. And which biceps? Which we got 2 plus for each so far. We're gonna do the biceps again on the right. And I can see some tricep movement on that one that time. I'm gonna go ahead and sit here. And just relax your leg in the hand. Certainly, that's normal. And my hand is a little cold, I apologize. Okay, that was normal. Alright, stereognosis test. Oops, nope, close your eyes. Alright, and I'm going to place something in your hand and you can tell me what it is.
Scissors.
Okay, thank you. And I believe that's it for the physical examination. Thank you.